Oh.
Oh.
Okay. Welcome back to the morning show.
That's right. Hello. Happy Monday. And oh my gosh.
Marshall Shore.
Marshall Shore.
Melissa, I almost said Marshall Shore, hip historian. That's not right. All right. I told you it's a Monday. All right.
Indeed.
So we are going to be doing a demo.
Well, we aren't.
I'm not.
No.
I don't know what I would be talking about, but we've got Dr. Tammy Penhollow back with us. She has been a guest with us before on season 2, and we loved her so much we wanted her to come back. We talked a lot about regenerative medicine, and this time we're still doing that, and we're also focusing on the back, on back pain.
Hence why there's a spine.
Hence why there's a spine. And I think this is great because I've been dealing with some back pain lately, so I'd love to hear what she's going to talk about today.
Indeed.
Do you deal with back pain, Marshall?
Well, it's funny because it's like this morning, I woke up like, oh, I slept wrong. And so I'm kind of like a little Quasimodo-ish today.
Yeah.
So, not really, but Paul does. I mean, he used to do yoga every day as a way to just kind of relieve some of that pressure on his back.
Yeah.
And so.
No, I know yoga is really great for that. Because that's kind of why I started doing it too, is just, one, to move my body, and two, it's just really good for stretching out any aches and pains and stuff. So really enjoy that. Okay, so here's the thing. We're going to stop talking about our personal back pain and bring in Dr. Tammy Penhollow to talk to you about how to actually deal with your back pain. Come on in. Hi.
Hello.
Morning. So good to see you.
Welcome
So
back.
happy to have you back. Yeah. Come on in the
Come
middle
on in.
here.
Thank you.
Get up and
Okay.
cozy
Let's get
with your
those.
spine.
So,
Okay.
okay,
that.
interesting.
Oh.
Okay, so we were chatting on email, and we were like, what should we talk about? And I was like, back pain. Everybody deals with back pain. I deal with back pain.
Yes.
So, why don't you talk, just in case folks haven't seen the previous episode that you were on, why don't you share a little bit about who you are and what you do?
Sure. Thank you. I'm Dr. Tammy Penhollow. I am an anesthesiologist, pain management specialist who works with back pain, joint pain. A lot of patients come to me with back pain, and they say that, maybe they have an event where they knew it happened and it got a little bit better, and then it just keeps coming back.
Right. Yeah. So my mom goes to a chiropractor. A lot of people have strong feelings about chiropractors either way. I've been starting to deal with back pain as I'm about to turn 40. So tell us, when people come to you for back pain, what are they usually experiencing? What's kind of going on?
Absolutely. Well, the back is not just what you see here.
Yeah.
I mean, this is a great representation. We're going to go through that, but they might say, oh, I have a bulging disc.
Okay.
Or I blew a disc out, or I slipped a disc. But the disc is just maybe one thing. So can we use the model here?
Please.
Okay.
Yeah. Here, I'll switch
So
with you. Why
let's
don't you do
switch.
this?
I actually have a semblance of a bulging disc on this, that little tiny red jujube right here. So the disc is kind of a jelly kind of substance that goes between the bones.
Oh, so the disc is not the bone.
It's not. It's
I always thought the disc
surrounded by bone.
Oh.
So what does it mean, slip, then? What does that mean?
So that's kind of a lay term where potentially you actually have just a little bit of a bulge, and it's slipped out of where it's supposed to be within its into the back portion of the canal, where then it can come into contact with these guys, which are nerve roots. And nerve roots come, say, down the leg. Have you heard of sciatica?
Yeah.
Yeah.
Okay.
Yeah.
So the sciatic nerve comes from the L4, the L5, and the sacral one. It's a big, huge nerve about the size of my thumb, and it comes out through here. But it sends that pain kind of radiating into the buttock, down the leg, and sometimes down into the foot. And so that slipped disc may be a fact that there's actually a little bulge or a little nipple of that disc that's coming into contact with the nerves. That then send the nerve pain down into the leg. But that's only one reason that you might have back pain, because who else is in this area? If I were to layer this back on, then we'd have these muscles that are about as size of, say, my thumb or a garden hose that fits all along up into here and attaches the low back all the way up into the top of the head.
Okay.
So those muscles are involved. Overlying the muscles are ligaments that help with twisting and extending and bending. And over that, we also have fascia, which is kind of like saran wrap that goes over every single little muscle, and it in and of itself is an organ.
Okay.
So there's lots of things that can kind of go awry.
So many things that can.
Oh my God.
If the disc is bulged, it's going to affect its neighbors. Okay. So we have to look at it as we don't just have this one problem at this one level. Its neighbors get involved. The muscles are definitely involved. It's not just the disc. There are joints here that get arthritic, just like your knee, just like your shoulder. And that can then create this system of pain where, yes, the disc may potentially get absorbed on its own, but the muscles are still mad. The ligaments are still weak. Okay. You've stopped working out, so then your core muscles are weak, and that puts this extra strain, and you're almost more like this. That closes those joints. But if we have a strong tummy, then you're more like this.
Okay.
So we've got more openness to all this.
Okay.
Yeah, she's saying that. My posture just corrected.
I did too. I was
we
like,
all did.
That's funny. I'm glad I wasn't the only one.
Our core.
I was like, she's doing that, and I'm like, oh yeah, I should.
I did work my core this morning though, so that's I feel good about that.
Perfect.
Okay, what is this another thing that you're flagging up here with the red?
Oh, this is an artery.
Oh.
So this is the vertebral artery. And if we talk about then, because back pain is everything. It's not just the low back. It can be the middle back or even the neck. And when we talk about chiropractic things or any kind of a high velocity manipulation with that crack thing, it illustrates that the vertebral artery is right in here. And sometimes you can get ripping open of the vertebral artery with too aggressive of a manipulation.
Okay.
That's not what we're here to talk about.
No, we're here to talk about the relief of pain.
Yeah,
exactly.
Not the hey.
Yeah, so let's do that. Why don't you share kind of what you do when people come in, how you treat them, and diagnose what's actually going on?
Absolutely. We do a complete physical exam. We look at the spine. We actually touch down on each of the bones here. We touch on the muscles. We watch your movement and see if it hurts to do specific things like closing these joints with this kind of emotion.
Okay.
That can kind of lead me to think it's more of the arthritic things here, or if you're having pain along in a band here versus pain sitting, pain lying, pain walking.
Oh, so all the different body movements adding stress and pressure in different places.
That's exactly right.
Wow.
Yeah. And that is interesting because my mother-in-law talks about how she has so much more pain when she lies down at night versus when she's like, she can walk and feel fine, but then when she lays down, there's like all this pain. And I'm like, how weird. Like, that seems like your body should relax.
And that would lead to a different pain generator than, say, a person that goes, have you seen them in the grocery store where they're leaning on that cart? Because it hurts to walk, but if you lean forward, then it takes that pressure off of
there.
Here.
Yeah.
Oh, so like that learned behavior of this just feels better actually has scientific.
It does.
Oh.
So once you get to the bottom of that, what the history is, what the physical exam is, then we do things like stabilize that core. We need to have this tower of power is what I call it.
Tower of power.
You know, this whole cylinder of very strong muscles. But once you've had chronic pain over and over for years, there are these muscles called the multifidus.
Okay.
Just think of deep.
Okay.
They're deep, deep muscles that connect from here to here, from here to here. And they get atrophied because they're not being used. So they actually get tiny and fat replaces the muscle. And then when you do go to work them, they're not going to respond because they become fat.
Okay.
Oh.
And then that creates this snowball. So stabilizing those multifidus, activating those multifidus, you'll see some people that'll just say, just do some squats, just do some deadlifts, just do those things, but not if you have atrophied multifida. You can't just do a deadlift.
Right.
You've got to work up to that.
So you can, once it's fat, you can bring it back?
If you've not killed the nerve to it, and unfortunately in some traditional spine pain management things. They actually cook the nerves that go to the arthritic joints because they say they actually put a little probe down and send 90 degrees centigrade for a minute and a half to literally cook the nerve, because then that turns off the nerve. So then it's supposed to make it feel better, not to have that feedback to your brain. But does that sound good to cook a nerve?
No, because the pain is there for a reason, to say something's gone.
Exactly.
That sounded horrible when you said
as you're saying that, I'm like, oh my God.
Well, it's called radiofrequency ablation is the long
Okay,
term.
okay.
But unfortunately, that nerve also goes to the deep muscles, the multifidi. So if the nerve has been cooked, then you're not getting blood flow and signals to the muscles to fire, so they're more rapidly becoming atrophied or replaced by fat. But that typically lasts about a year, maybe a year and a half. So if you've had a radiofrequency ablation, or if you've been immobile for so long, then you can slowly start to rebuild. So we've got some technology can do that. We've got physical therapists we work with that can do that.
Okay.
Yoga, Pilates, think of anything really deep core stuff.
Right.
And then there are other things that are very temporary. We talked about even the radiofrequency ablation is temporary, although it cooks for some time.
Yeah.
You could do a steroid injection that could temporarily calm down some inflammation around this.
And that's sort of the most common that I've heard of people having.
It seems to be really popular.
It is. Yeah. And it is a Band-Aid. It's not going to make the disc bulge go away.
Okay.
A surgeon could shave off the disc. He could suck it out. He could do replace the disc if it's so low that we don't have that cushioning. But we can do some things that are in between there. I think long term, because again, we said the back pain just keeps coming back.
Right. Yeah.
Right. So that means we've not addressed the root cause.
Correct.
And the root is all these things. It's the core. It's those things. So instead of using the steroids or the cooking of the nerves or something that is more destructive, we're about building.
Okay.
Building the core, building the muscles, replacing the fatty muscles. And I use platelet-rich plasma.
Okay.
We talked about that, and
we did
the first time with the knee.
And it was fascinating.
Right. And I want to just say again that this is where you have to be careful, that not all PRP is created equal.
Right.
That if you get blood drawn in something like a test tube, then that is totally different than getting blood drawn into a system that can concentrate the platelets and give you what you need.
Yeah.
There's still people out there that are drawing 15 cc's of blood. This is just water with turmeric, because turmeric's a nice anti-inflammatory, by the way, versus the minimum I'll draw is 120.
Okay.
So imagine the power of 120 cc's of blood to concentrate that down to get the number of platelets, which are growth factors, which are anti-inflammatory, which can be placed inside this space in the epidural space instead of the steroid, can also be placed in these joints, can also be placed in the muscles, can also be placed in the ligaments, can also be placed. How much, more bang are you going to get from this versus this?
So this is an injection then?
It would be an injection using a C-shaped X-ray to guide you exactly, because I don't have X-ray vision.
What?
I know.
Bummer.
I know. But you want to get exact precision medicine with this. So it's the right injectate and the right person in the exact right spot at that time. So you're optimizing them first, then we're using the injections, and then we're going back to, we don't just say, bye, see ya. We're going to work with you to get you back to the levels of your previous activity. And hopefully we decrease the total number of flares you have, or greatly increase the intervals between those flares, because we've made your back stronger.
Yeah. Yeah. So I know a lot of people are very hesitant to get surgery on their spine, on their back. And so they do try to do the steroid shots, for as long as possible to hold that off. Yeah. But this sounds like, just to clarify, that it's not just a Band-Aid like the steroids are. This is actually doing the work to rebuild and help heal kind of what's happening.
That's exactly right. Yeah. That helping heal, help get you through that, not only your acute phase, but to reduce the risk of you having another flare in the future, because we're putting you back to where you were before the original injury, with the stronger muscles, with the decreased inflammation around the disc, with the less arthritis in the joints, if we can get the anti-inflammatory part of your body turned on,
Yeah.
then it can work on those areas.
So why isn't this as popular as steroids? Why doesn't everybody?
Boy. I made a huge paradigm shift 10 years ago.
Yeah.
Because I was seeing that the steroids were just Band-Aids. And so I quit that traditional pain management and said, if I'm going to come back and do this, it's going to be in a constructive format. So it took a complete shift in the education of platelet-rich plasma or bone marrow derived or adipose derived kind of therapy. It is not quite as popular as those things because not everybody's doing it, number one. And it's what the insurance will pay for is steroids and burning nerves and surgeries. One of the most lucrative things that can be done is a lumbar fusion, meaning taking and putting screws and rods in here. So that is very lucrative. And ultimately, there's a certain percentage of failure that occurs because if you make a segment rigid, then the guys above and below have to be extra moving. And then they get arthritis. So then you extend the fusions. So you had a 1 level, now you have a 2 level, then you have a 3 level. Lucrative, lucrative, lucrative.
Okay.
So insurance gets paid to make money.
Okay.
Hospitals make money.
Right.
Right. So this is a money-making thing to keep people within the system by giving them medications, by giving them steroids to temporize until they go to the surgery.
Okay.
So I think it's that.
Yeah.
Platelet-rich plasma or bone marrow-derived therapies are not covered by insurance. Okay. So that's a big factor.
Yeah.
So we talk about then what are we gaining by investing in your health with your own cells versus paddling water underneath the surface of the skin, of the the
or just keep
pond.
slapping a Band-Aid on that you
Exactly.
Yeah.
Exactly.
So if someone has been suffering with back pain, they've tried lots of different stuff, they want to come to you to talk about what might be possible for them. Can you share kind of where and how they do that and what that process looks like,
Sure.
how long it takes, that kind of thing?
I partner with people for spine pain for about 6 months.
Okay.
It's not a magic one and done thing. It is that preparation. It's the anti-inflammatory model of eating and potentially correcting some deficiencies like vitamin D3. If that's low, then we're not going to get where we need to go. Plus, it helps with bone health and nerve health and the whole thing. So, PrecisionMedPRP.com is my website. And on that website, there are so many ways to find me, including I've developed a patient guide to ethical regenerative medicine, and that's free. So they can get that for free. They can watch the videos and go specifically to the spine section on that. But it's a partnership.
Okay.
We are partners in getting you better. So it's not me doing unto you.
Right.
We are together and we're getting feedback from each other. Oh, this worked. This didn't work as well. So let's double down on the part that worked, or let's make a little adjustment so that something else works better for you specifically, and it'd be a different program for you.
And also what I'm hearing is it's like everyone's talking about like the steroid injection. And so that's kind of like coffee table talk.
Yeah.
Where this is much more personalized as opposed to one treatment, one and done for everybody.
Right.
Yeah.
But really that working with you, it's like, okay, let's talk about what's really going on.
Right.
And a personalized plan.
A personalized precision plan.
Yeah.
Right? Because we bring in that. It's all about your labs. It's about your exam, your scans, and then precisely delivering it, not some shotgun thing, blind.
Yeah. Okay, I'm going to ask the question that I know probably a lot of patients are wondering. Does it take like a year to get into you?
No. I could see somebody later this week.
Okay.
I intentionally have a small practice so that I can set aside 1-hour consultations for people. As long as we've got some baseline x-rays or MRIs already done, then that can accelerate the process. But otherwise, I can order those and you can go out to have them done.
That's great, because I know that's a big challenge for patients in a lot of different specialties is you're in pain now, you're suffering now, and you can't get in until 4 months, 5 months. And it's like,
for a year.
I know, what am I supposed to, I know I waited a year for a specialist and then it didn't help, but it's fine. But no, this is fantastic. And this is kind of why I wanted to bring you back, because I just think that I've talked to so many people that have done the steroids and have done lots of other treatments, and it hasn't been a successful option for them. They're still not really wanting to do the surgery. And so I think today talking about PRP and that this option is also available is so great. And thank you so much for being here and sharing your expertise with us.
Yeah, and educating us. I love each time you come on, we learn something.
We do,
is
yeah.
So nice.
So now what we'd love to do is, you might remember in our old studio, we had the wall that everybody signed. Well, now we have a Jenga set. So we would love for you to pull a block out of the Jenga set and then sign it on the side and place it on top. And it's just a fun way to commemorate your visit here.
Thank you.
Yeah, thank you so much.
So good to see you.
Yeah. All right. So we're going to play a little bit of Jenga. Make sure you keep it right here on Robot TV. We're going to be right back after this break with even more good stuff. All right, let's do it.
And if I make it
pick
fall,
a color.
then it is what it is, right?
You're pretty early.
Okay.
So I don't think you will.
Hate is loud. It gets clicks. It gets attention. Hate, however, is actually quite small. But love is the majority. Filling up something far more important than any feed. Love fills our hearts, our lives, our every day with understanding, empathy, and compassion, leaving hate to become what it truly is, a whisper.
My biggest fear in the middle of my addiction was that I would never be able to get over it and that my kids wouldn't have a father. I started thinking, you know what? This isn't my story. For the longest time, fear held me back from ultimately being who I wanted to. I had to become a better man to be a better father. It's important to me that my kids are empowered and truly believe that if they can think it, they can do it.
Busy, busy. Busy, busy. So busy. Very busy. Busy, busy. I'm busy. So busy. Very busy. Busy, busy. Busy, busy. So busy. Very busy. Busy, busy. I'm busy. So busy. Very busy. So busy. Very busy.
How do you know when you've made the right decision? It's the feeling you get in your gut. The one that tells you what's right or wrong. It's the one that says, sure, I can have a drink. Or the feeling that says, okay, I've been drinking. Now what? It's the voice inside you that says, I'm buzzed. Better leave the car when it's time to go. Plan ahead. Catch a sober ride. Buzz driving is drunk driving.
Hello and welcome back to the morning show. I'm Marshall Shore.
And I'm Melissa Farley. We're here at the fabulous 726 Studios
in the heart of Roosevelt.
Yes, we are. Okay, so Twinkies. We're doing Twinkies today.
That's right, we are, because it is the 95th anniversary of Twinkies.
Wow.
Not these Twinkies. These Twinkies have not been
Well, that is a theory that they could like
So,
live forever and through a
they only
nuclear
made
war.
X number, and we're just.
It might be the 95th anniversary of these Twinkies. You don't know. You don't know what warehouse they came from,
Well,
Marshall.
that is true.
Are you a Twinkie fan?
I have been. So
What does that mean?
so when I first moved to Arizona, I started working at the library, and somebody's like, "Oh, we're having a white trash party," and I'm like, "Okay, what am I gonna make?"
Okay.
Because it was a potluck.
Yeah.
And I'm like going, well, Twinkie pie.
Twinkie pie.
So you make fake Twinkie cream, and you put a layer of Twinkies.
Okay.
A layer of fake Twinkie cream, more Twinkies, and you just keep layering.
Okay.
There was none to take home.
That sounds more like a casserole than a pie if you're layering.
Well,
just say it.
I was like, wow, there's a lot of shortening in this dish.
So I'm not the biggest fan of Twinkie. I don't actually like cream that much. Like I don't really.
You can just eat around it.
Well, that's what I do. Yeah. Like even on because I like what are the cupcakes called? The little cupcakes. What are they?
Oh, I know there's a Hostess cupcakes, but I don't, or like ding dongs.
Yeah. And so I like eat around. I just eat around the thing. But my husband's the opposite. He loves like anything with whipped cream that's like cream filled, whatever.
Okay.
So he's a big Twinkie fan. But
so we have flavor. See, and I would say I'm more of a purist. It's like the pure original,
Twinkie?
as opposed to now we have a flavor. Actually, I say it's like unless he uses the banana one.
When's the last time you had a Twinkie?
Probably.
When you made the pie?
Probably. I'm thinking like, yeah.
Did that ruin it for you? Pie?
But although I have had people talk about that, and it's like, really?
Okay. I love that he brought us knives for a Twinkie. What do you want us to do with the knife? Like, should we judo?
Yeah.
Whack!
Well. Oh, and then it kind of spoosh it.
Okay.
Oh, we look so civilized.
Oh. Is that what we're doing?
I don't know. I was like, we have a knife, so. And that is indeed a Twinkie.
That is a Twinkie. Oh. I tell you what, I was doing really. Wow, that's sweet. That kicked in like. That is so sweet.
In 20 minutes we'll find you curled up under the Jenga.
We're like
and taking a nap. Although, I'm kind of more concerned about this, just because.
Why?
It's not the classic Twinkie.
But you know what I just noticed? The chocolate Twinkie is healthier for you than the regular Twinkie.
Oh.
Why would that be?
Are there less chemicals in this one? Oh,
Twinkie.
It feels really moist.
It does feel really moist.
Much moister. Moistest. Maybe it is the moistest.
The moistest. There are people who absolutely hate that word, moist.
Well, I mean, it kind of has.
I feel like I'm gonna like this.
Very weird word,
but maybe not.
And is it chocolate cream?
I like that.
It's chewier than the other one.
I like it. I also didn't get any cream, so maybe that's why I'm enjoying it more.
Yeah, no, I did. It is. So I was like, oh yeah, I think the cream is chocolate as well.
Okay, so I have a question. Like in donuts, do you see the little like hole where they put the cream in? Oh, it's on the bottom.
It's on the bottom.
Oh.
So just, I guess, kind of there's little things like poke in your Twinkie and.
So, historian, why did?
I've done no research on the history of Twinkies at all. So.
Okay, well then just postulate. Why do you think Twinkies got so popular? Like they were really, really popular for a long time.
I think you had 95 years ago. It's like you didn't have convenient stores you could walk into and buy things. So this was one early treat that you didn't have to sit in your kitchen, bake
and
some
make
cake.
it.
Right.
Yeah.
And so I think it was kind of that whole process. And then, in the 50s, it was just like this was considered highbrow. It's like, well, look, it came in a sealed plastic thing. It must be good.
Did I hear a rumor that they actually stopped making Twinkies for a
I know.
while?
I think they did I think they shut down making, and then someone else bought the rights to the name. So it's like, so there was a period where I don't think there were Twinkies.
So has it been 95 consecutive years?
I
or
don't
is there
know if
like
they actually allowed. I think it's 95 years since the original Twinkie. I don't think they're like, oh look, we didn't make Twinkies for this 6-month period. So
Here's what else I wonder, right? Like, I can't remember the movie, but there was like a movie where like a little bug lived inside a Twinkie, like at the end of the world. Am I dreaming that? No, I swear there was a movie where a little bug lived inside a Twinkie. But how, like, what I'm wondering is, did someone find like a 20-year-old Twinkie and open it and be like, oh, this is still good, I'm gonna eat it? Like, how did that whole thing come up? Or just because it's so filled with preservatives? Like, should we see? Wow, why is there so much salt? That's a lot.
I mean, there's a lot of things: phosphates, enzymes.
You're an enzyme.
There's also water. Oh.
What are you owing?
And tallow.
Oh. Uh-oh.
So, I mean, I'm like, oh, I guess that me. So,
You.
I know. I just had some beef fat.
Yeah, I was just going to say, for people that don't know what tallow is, yeah. Have you heard of that trend that women are now putting tallow, like, all over their skin? Like, that's a big thing. And that, I don't understand it.
Because they see a cow and they're like, how can I look more like that?
Cow has gorgeous skin.
Exactly.
I want to look like
well, have you
that
seen
cow.
Elsie? The Borden cow.
No. Should I have seen Elsie?
Yeah,
Was she here?
No, she's the cow with the pearl necklace and a little like flower in her hair.
Oh, yeah.
Yeah.
Okay.
So
yeah.
I mean, she's pretty.
She is pretty. Okay.
It doesn't mean I necessarily it's like, I want to look like her. I'm going to slather myself in her fat.
All right, so vegetarians, vegans, beware. There is
Yeah,
tallow
I didn't realize
in a Twinkie.
Twinkies were not.
Yeah, I don't feel shocked anymore. Ever since you told me about Jell-O, now I'm just like suspicious of everything. So,
Indeed.
but celebrate National Twinkie Day. Grab yourself a Twinkie, have fun.
There's other
Favorite
flavors.
flavor.
There's banana. You can even hide things in Twinkies.
Like a bug. All right, we're going to take another quick break. We'll be right back. After this, keep it here on Robot TV.
So as a technical sergeant, E6.
I served in Vietnam in 1969.
I am a U.S. Army veteran.
Have you ever helped a fellow veteran?
Of course.
Yes.
Try to always be there for each other.
I do my best reaching out to my brothers and sisters in arms.
Have you ever asked for help yourself?
It's always tough, right?
I can't say that I have. I mean,
If you don't have someone to kind of help you guide those thoughts, it can be really bad.
Eventually, you just can't deal with it on your own.
I guess it's a part of the military too, right? Service before self.
It was drilled in, service before self.
And you start to question, maybe people would be better off without me, When you realize that you're not alone, once you take that first step, there's so much support.
For decades, I've taught you everything I know. How to safely build a fire, and how to control the flames. But I can only teach wildfire prevention. Only you can prevent wildfires.
Hi, I'm Ryan Blaney, a third-generation race car driver, and we dedicate a lot of our time to going as fast as possible. My grandpa Lou is the reason why my dad and I started racing, and I'm really proud to follow in his tracks. But when my grandpa was diagnosed with Alzheimer's, it was a very unexpected bump in the road for us. I've learned a lot on this journey with my grandpa Lou, and the memories of my grandpa will always be with me. And in our family, we're used to getting involved, and I encourage you to do the same, especially when it comes to caring for your loved ones. When I think about Alzheimer's and the impact it had on my family, I recognize that losing a race isn't such a bad day after all. It's important to notice if older family members are acting differently, experiencing problems with their memory, or having trouble with routine tasks. Talking about Alzheimer's can be really tough, but if you notice something, have a conversation with your loved one. Encourage them to see a doctor or offer to go with them. Early detection of Alzheimer's can give your family time to explore support services, make a plan for the future, and access available treatments. If you or your family are noticing changes, it could be Alzheimer's. Talk about seeing a doctor together.
There is a road laid out for me. First night here, but Amy seems cool. Leading down to the river. I am blind, but I need not see.
What do you think?
I know this road is there for me. If I'm really free, take me down to the river and